Researchers have confirmed that there are parasitic brain worms that have been found in metro Atlanta. Brain worms? Yep, you heard that right. There are parasitic brain worms that go from rats to snails or slugs to humans that have been discovered in Atlanta. I'm not talking about neurocystic which is a common form of brain worms that you can get from eating raw pork. I'm not talking about the brain worm that was recently found in that woman's brain in Australia. I'm talking about the rat lungworm, also known as angiostrongyliasis. You mean like rats. Researchers examined rats that were found at Zoo Atlanta, and over 20% of these brown rats contain this organism. It's a parasitic worm that's found in rats' lungs. Well, how does it get to the human brain? What happens is these larvae are living in rat lung, and the rats can cough it up, ingest it, and then pass on these larvae within their feces. It can then develop within snails or slugs, and humans can ingest these snails or slugs or even on vegetables that these guys have then been on top of. And once the human ingests it, it can go to their brain. Literally, I've never heard of this before. That's because the good news is it's extremely rare. Try not to eat raw snails or snails that have been chopped up into salads. Most infections occur in Southeast Asia, but now that this species has been found within Atlanta, it's suspected that more cases may pop up in the Southeast United States. But I do think it's important to spread awareness because we may see some cases that are popping up of what's called eosinophilic meningitis. Patients infected with this parasite may complain of GI symptoms, headaches, nausea, vomiting, and even seizures. They will present with symptoms of meningitis, and upon lumbar puncture, where you can sample the spinal fluid, the CSF will be populated with a large majority of eosinophils. So if you have a patient presenting with eosinophilic meningitis, make sure you ask their travel history and what they may have been eating. You can send the spinal fluid for a PCR test to confirm the diagnosis. The good news is that most cases are asymptomatic or very mild, but if it travels to the brain, it could potentially be life-threatening. The bad news is there is no specific treatment to handle this infection. It's usually treated with anti-parasitic medications, steroids, and pain management. So if you want to avoid getting this disease, make sure that you don't consume raw snails. And if you do handle snails or slugs, make sure to use gloves or wash your hands. Stay safe out there, guys.